Kruger National Park, South Africa. Amidst the stark beauty of the savanna, undergraduate students from Northwestern University learn about South Africa's public health and development and the struggle to provide healthcare in remote areas.
Students encounter the daily practice of health at a village level in a rural area in a country that is massively underprovided. For example, they will meet the extraordinary teams of home-based care women who walk up to 15 miles a day delivering medication to patients with tuberculosis or HIV.
We went to 3 different clinics, hospitals, private hospitals, and got to see how they were compared. In some places, you can go to a clinic and you can get all of your medications for anything for free, but you have to wait for 5 hours before you can see anyone.
Most of these students are earning minors in global health. Undergrads who continue on to the Feinberg School of Medicine can later apply for clinical rotations in South Africa, which are eligible for GHI Fund support. Despite the triumph of democracy with Nelson Mandela in the 1990s, apartheid's legacy of oppression and segregation still lingers in South Africa. Only 30% of the nation's physicians work in public sector healthcare, which is the sole provider for 84% of all South Africans, many of whom live in slums surrounding cosmopolitan cities like Johannesburg, Stellenbosch, and Cape Town.
Almost 20% of South Africans are HIV positive. It's one of the largest prevalences in the world, and most of the HIV is occurring in patients who have fewer resources.
Natalia Yareda is a fourth-year medical student at Northwestern's Feinberg School of Medicine, whose studies are supported by the GHI Fund. Yareda is a future OB/GYN who works with HIV-positive children in Tygerberg, a suburb of Cape Town.
I think the HIV doctors here also kind of double as primary care doctors, and I think in most cases they're the only providers that these patients are seeing. So often they try to also give vaccines to the patients and kind of check in on any other issues that they may be having. We really try to always remember to ask patients why they're struggling with something or why they're not adhering to a medication. Sometimes you'll talk with a child who says, I get really nauseated after I take the medications and there's not enough food in my house. It really requires you to work with patients to find a solution that's feasible for them. Rachel, we can talk about it.
"10,000 miles away in the American Great Plains, Wolf Point, Montana, also bears the weight of isolation and poverty. Wolf Point is located on the Fort Peck Indian Reservation and is home to just 2,600 people, half of whom are Native Americans.
We see a lot of drug abuse, alcoholism, and I think that's a part of the culture of poverty, of which there is a lot on the reservation. Heart disease, diabetes. Native Americans are plagued with diabetes. And we see lots of unplanned teenage pregnancies.
Family physician Mark Zilkowski directs the rural Listerud Health Clinic. He's known around town as Doc Z, and he is one of only a handful of practicing primary care doctors in a 50-mile radius.
I also work in the hospital, where I do C-sections, gastroscopes, laparoscopes, minor surgeries such as appendectomies.
Through the Center for Global Health, the Global Health Initiative Fund, and the Department of Family and Community Medicine of Northwestern, Dr. Zilkowski mentors Feinberg medical students who are interested in providing primary care in rural America. They quickly learn that in much of Montana, primary care doctors must make the best of their isolated town's limited resources and facilities in order to meet the needs of their patients.
So if they needed to go and see a specialist or get a special test that's only offered in a major city, that's a 5-hour drive potentially, and who knows how much money. I think it makes Dr. Zilkowski rely on physical exam skills and old school medicine a bit more than the person who has every resource at their fingertips.
Never is this more critical than when patients are in crisis and may need care elsewhere.
You have to make the decision between treating someone now emergently in the hospital with limited resources or delaying treatment, trying to stabilize them temporarily and get them on a plane.
That experience just showed me that I need to think on my feet a little bit more and actually try not to practice cookie cutter medicine.
Good medicine is ordinary things done well. We're out here in the hinterlands, but what we do real well.
The Global Health Initiative Fund not only sponsors medical students, it also awards grants to outstanding Northwestern University undergraduates who have been admitted to Northwestern's Feinberg School of Medicine.
With this funding, I was able to spend 8 weeks at this clinic in Guatemala, studying this nutrition program and looking at the efficacy of how well it was working. With the results of my project, they kind of refocused the nutrition program to maximize the impact of limited resources.
The GHI Fund is also proud to expand its support of future physicians by sponsoring an international medical rotation at Northwestern University for students from host universities around the globe. Transformative experiences produce exceptional physicians who are adaptive, empathetic, and resourceful. GHI-funded students become doctors who provide compassionate care wherever they call home.
Even if we don't go outside of the borders of the United States, we know that 13% of our population are immigrants from other places. So understanding global health, understanding how we relate to cultures other than our own, helps us treat those patients more effectively with more respect.
The Global Health Initiative provides a really unique opportunity for a lot of students to have global health experiences early on in their careers.
I think it's a really valuable and unique experience to see patients in the communities where they live and learn and help address the barriers that they have to accessing health care.
It was just really inspiring to see that patient-doctor relationship in real life.
For me, the Global Health Initiative has really acted as a catalyst for what I hope is a long career in global health.
The Global Health Initiative Fund is proud to support our doctors of tomorrow. Men and women who strive to see the humanity in every human they meet, and who affirm this global truth: exceptional doctors provide health and care.